Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
Yeah, thanks for having me here. And it's Epilepsy Awareness Month anyway, so it's a nice time to talk about epilepsy and spread more awareness about epilepsy.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
So, what one has to know about seizures is basically in everybody the brain has a basic electrical activity, and for some reason or because of multiple reasons, sometimes the brain develops an abnormal electrical activity, because of which the patient or the individual develops certain problems like becoming unconscious or having jerking movements of the limbs. Sometimes it may be just a confusional behavior. So this is what we commonly refer to as seizures, or what we commonly refer to as fits in layman language, or in general what we refer to as seizures.
What is epilepsy?
When an individual has two or more unprovoked seizures, meaning there is nothing which has triggered the seizure. So somebody who's just sitting calmly and going about his work, suddenly they have a seizure. When it happens two times or more, it's called as they are called as an individual who is having epilepsy, and usually these are the people who require long-term medications.
What are the different types of seizures and do they affect people differently?
Yeah. So seizures are, they can present in different forms, different manners. So most commonly what we see is an individual becoming unconscious, having jerking movements of the limbs. Sometimes they may pass urine also, they end up biting their tongue, having bleeding from the mouth. This is what we commonly refer to or commonly see. But apart from this, there are different types of seizures. Sometimes the individual just becomes confused. You're talking to them about some topic, and then suddenly they start speaking randomly, totally out of context. And sometimes we see individuals who are just having jerking of one limb. They're aware of what's happening, but suddenly there is some jerking of one limb which happens for a few seconds, and they're all right completely. And in children, we see a pattern of seizure called as absence seizures, where the child is sitting comfortably in his chair, listening to the class, and suddenly they zone out. They're holding their posture, they're looking straight at the board, but they're totally unaware of what is happening around them. So this can happen for a few seconds to few minutes and multiple times in a day. And usually nobody is aware that the child is actually having a seizure. Then this can go on for days together, and it starts affecting their academics also in school. So seizures are of different types, and whenever there is any suspicion of having a seizure, you always visit a neurologist so that you can sort out what the problem is, what type of seizure they're having, and how to manage it.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
Almost half of the patients who come with epilepsy, sometimes all the workup can be normal. Your scans, EEGs can still be normal, and you can be still diagnosed with epilepsy. But amongst the people who have a cause, usually it's like a injury to the brain, mainly if it's let's say a road traffic accident which has led to damage to the brain, or sometimes let's say there's an infection in the brain or a tumor sitting in the brain. So all these things which can result in abnormal electrical activity in the brain, which uh, because of which they have a tendency to have repeated seizures. So then we call this as epilepsy. So like I said earlier, whenever we say there is epilepsy, you have to take medications for long term. We're talking about at least 3 to 5 years. In some instances, it can be lifelong as well. So it need not be that you find something in the report to say that the individual is having epilepsy.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
Yeah, so actually, there's a lot of help a caregiver offers because largely more than anything else, the semiology, the pattern the individual has, it helps in identifying the type of epilepsy. Like I said, usually becoming unconscious and having jerking movements of the limbs is what one has to notice. Apart from that, of course, it can never go unnoticed. Apart from that, like I said, suddenly having totally irrelevant talking, becoming confused, not able to speak properly for few moments, or like I said, zoning out, becoming blank suddenly, not able to answer in the context. So these are the things one can identify. So only once we do all the pickup, all the relevant tests, that can be converged to the diagnosis of epilepsy. So what happens is, like you say, you have cough or fever, you go and you tell the doctor that I'm having cough, I'm having fever, so you need, so you have so and so problem, so you can take the necessary treatment. What happens in patients with seizures or epilepsies, they are totally unaware of what is happening to them. In fact, they lose consciousness, and to make things worse, when they regain consciousness, they also tend to forget. They don't have the memory of what's happened in and around the time of their seizure. So, what the caregivers or the people who are uh, around the time of the event when they have the seizure, what they offer or what they provide, it becomes really essential in managing the patient.
Now, let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
Yes, so stigma in patients with epilepsy is very common. So this largely happens because of unawareness, poor knowledge about epilepsy. See, it see if you see anybody having a seizure, it is generally a little scary. Somebody becoming unconscious and vigorously shaking the limbs. It can come across as a scary thing. So what happens is most people don't have adequate knowledge about it. So whenever there is no knowledge, it leads to a certain fear. So that leads to a stigma. So because of this, patients with epilepsy face a lot of stigma, and that leads to a lot of stress, and they have several problems because of that.
How does this stigma affect people with epilepsy?
So what happens is, I had one patient who was a brilliant chap. He was doing his hotel management. He's completed his hotel management, but because he was having epilepsy, nobody was recruiting him. He had a very tough time getting a job. So similar things, when a woman has epilepsy, or even for men, for that matter, they get rejected for marriage. Nobody is ready to marry them. So this again, like I said, is largely because of unawareness of what actually epilepsy is, and also about so many other misconceptions about epilepsy. So what happens is, because of the rejections in different fields, like they get rejected at their job, rejection in marriage, this leads to a lot of stress, and even stress sometimes can end up precipitating another seizure episode.
Absolutely. Now, let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
So patients with epilepsy, there are certain situations in which uh, the, it may precipitate, it may lead to having a seizure. Okay, so there are things which can precipitate or lead to having a seizure. Commonly, so these are called as triggers, and common ones are having a lack of sleep, uh, consuming alcohol, uh, having a lot of stress, women around the time of menstruation, and uh, any other illness, having a severe fever, a viral fever of that sort. So all of them are called as triggers. Whenever they are there, there is a chance that the individual may have another episode of seizure.
That's a great tip, doctor. What other lifestyle adjustments can help someone manage epilepsy?
So basically, largely having awareness of what the triggers are helps in managing seizures. So, like I said, having a good sleep, at least 7 hours of uninterrupted sleep, having a balanced diet, and physical activity in moderation. If you exhaust yourself too much, that can also precipitate a seizure. So, having balanced physical activity, not until the point of exhaustion. This helps in managing your seizure. Also, learning how to manage stressful situations. So, doing yoga or meditation, breathing techniques, all of them help in managing stress and thereby help in managing your seizures or epilepsy.
Thank you so much, doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
Firstly, basically, any individual with epilepsy, they have to be stringent with taking their medicines. They have to take medicines regularly. Apart from that, making sure uh, not to have, like, suppose somebody is having a seizure, the immediate thing you do is clear out the area, take out all the sharp objects or anything which may hurt the individual, put him down on the floor, turn him to the left side if possible. Try not to put any iron rods, keys, nothing in the hand, they're not going to help. Don't try to stop the bleeding from the mouth by putting anything in the mouth. A tongue bite will heal quickly, and tongue bites which end up bleeding, usually you don't need to panic about it. It may look scary, but trust me, you don't need to panic about it. It heals very well. And if suppose you have somebody who gets seizures repeatedly at night, preferably have a carpet next to the bed in case you fall, you are well protected. So uh, even in the kitchen, sometimes you can have non-breakable dishes which help in preventing any sharp injuries.
Thank you so much, doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course. Any final thoughts?
Yeah, so just to summarize, I think it's best to consult the right doctor, get the right treatment, and please do understand, and everybody has to know, and this awareness has to be there in the community that patients with epilepsy can lead a full life, and you have to avoid the triggers. You can be safe taking your medicines regularly, be on regular follow, and never feel isolated. You don't need to go through the stigma and never feel isolated. There's a lot of patients with epilepsy who are leading a very happy and full life. And any issue, whether it is physical, mental, social, whatever it is, you can always seek out the help of your neurologist. They were always there to help you, and you need not worry about it. There's a big community to help an individual with managing of epilepsy, and you need not worry about it. You can be happy and continue with your regular work in regular life.
Thank you, doctor. And thank you to our listeners. Until next time, take care and stay informed.